Welcome everyone to premature optimization session. As you may know, it is a concept coming from computer science, which is highly relevant to our healthcare data science projects. Premature optimization refers to fine-tuning or too much attention on a specific module of your project. I'm Fatemeh Torabi. I'm an assistant professor of healthcare data science and glad to be here talking to you about this concept today. So in terms of the project example, we looked at the vaccination safety project. We looked at the pipeline, the primary and secondary outcome for this project. Specifically, to recap a little bit about what we discussed, we were looking at risk of thrombocytopenia, hemorrhagic and thromboembolic events during the COVID-19 or vaccination periods. For this, the major events are defined and our exposure are either vaccination or COVID-19. So in terms of project development, we need to capture these as the minimum objects from our project. How we develop? We create our cohorts by linking data from across different data sources. Primary care, secondary care, administrative data come together to make sure we can capture patient pathway. We can capture from the time point they had a confirmed PCR test for their COVID-19 or they got the vaccination and different dosage onto their boosters. So this is the core of our project. And then the major outcomes are those thrombocytopenic, hemorrhagic, and thromboembolic events. There are some comorbidities, such as smoking and BMI. To give you a sensible example of premature optimization, where we have too much focus on fine-tuning BMI variable. Sometimes, and this is happening across many of the projects, we keep cleaning that variable. We keep going back to ensure it's complete. We do a lot of imputation or a lot of hunting for BMI recordings for 65 million patients in England. And that gets us in a black hole. You don't have the whole project coming together and there are a lot of attention on a single variable. So the solution for this is to modularize. As you can see, this is a very small part of the project pipeline. In this, we have different modules representing BMI and smoking. So when the data becomes available or we have additional data sets to be linked to this, or we have an algorithm that represents BMI for the entire population, we can integrate it into the pipeline. Reproducibility is another key factor where we make sure the pipeline is reproducible so that when we incorporate and get 90% completeness on our BMI variable, we can rerun all of our analysis again and update all of our findings. It happens also when people get the booster, when new vaccination type comes in and became available to your project. So modularization makes sure that you can incorporate the updates into your project pipeline, as well as being responsive and agile to any input from your clinical colleagues or other stakeholders. To quote Sir Tony Hoare, who is a well-known scientist in this specific area, he says, premature optimization is the root of all evils in programming. And programming is how we translate our research questions from the clinical context into database languages. This translation, meaning that we are developing those programs in using R, SQL, Python, or other programming languages to establish our phenomenon into database languages. So make sure to not get bogged down into a single element by modularizing and reproducible pipelines. Thanks very much for listening.